Hey everyone, so I've seen quite a bit of people defending the Medicare for All proposal from Bernie Sanders. They claim that the $32 trillion price tag is a bargain because it saves $2 trillion over the next 10 years compared to the rate at which we pay now. First of all, I made a video on this and I had a good amount of people mentioning that. I don't think I mentioned it in my video, but I wrote it several times in response to some of the comments. That $32 trillion price tag is an extremely low estimate. In fact, it's so low that it's barely even an estimate. It's more of an example of what could happen if we lived in a world where government intrusion had no unintended consequences whatsoever. Now, what do I mean by this? I mean that the numbers that get you to the $32 trillion figure assume that hospitals, doctors, and medical personnel would stay in the field, stay in business, or be able to keep prices in check if they are only reimbursed at a 40% reduced rate. Meaning that when they provide care to a Medicare beneficiary, their costs are only reimbursed up to 40% compared to what private insurance will pay, which is a far higher reimbursement. There is no way to tell exactly how providers would react to this, but I think it is very unreasonable to think that they would willingly accept this, and you would almost assuredly see a decline in health services, which again puts an upward pressure on prices. The plan also fails to take into consideration the large increase in demand within the healthcare industry, which you would frankly be a fool not to expect. This will also create a significant upward pressure on prices. Again, the Medicare for All plan does not take this into consideration. The celebration over a supposed $2 trillion saving seems to be coming from those who may rightly want things to become better, but you can only cast your support for Medicare for All if you're going to ignore how organizations react to being paid less and by ignoring how people behave when the government assures them they will never receive a bill for a service rendered to them. Also, as I alluded to in my other video on this topic, it is a sad, sorry story when there is a group of people cheering and applauding for a $32 trillion government program, even if it ends up saving us money, which it won't. The reason why I consider this sad is because we can do far better. Now, this brings me to my next point. I think it is pertinent to mention that I do not advocate doing nothing, as some people have suggested. I have yet to meet a libertarian, for example, that thinks our healthcare system is fantastic right now and no changes are needed. Getting the American Medical Association out of the business of monopolizing licensing would increase the supply of medical services. This would have a downward pressure on real, actual prices, not just insurance, but healthcare costs themselves. Ending the rules preventing people from purchasing health insurance from state to state. Again, this would encourage far more competition and thus have downward pressure on prices, as it does in nearly every other industry. Ending the rules on insurance plans that allow a robust market on catastrophic plans. This would allow more options to different individuals willing to take on different amounts of risk, as well as having people actually see more prices, especially in regards to the more routine and mundane care. This would also cause people to be more price sensitive and incentivize shopping around. Again, this would lead to more downward pressure on prices. I feel like I keep repeating that phrase, but there are quite a few things that would do that without further increasing the already huge government role in healthcare. Now, I could keep this video going on for quite some time on the different ways in which undoing the problems government has caused in the healthcare industry would help us, but what it really boils down to is this. People speak as if we have a robust free market in healthcare. But healthcare, especially in the past few decades, has increasingly become more and more intruded upon by the state. People will blame private insurance companies for a rise in prices or our rising premium and deductible cost. And I scratch my head wondering if they've ever thought for a moment that maybe the subsidies these companies receive cause a perverse incentive. Perhaps, maybe the rules and regulations on what plans must cover might have an impact on prices. Maybe the preventing of people purchasing plans across state lines might create more of an oligopoly than there otherwise would have been if private insurance companies were not given their statewide market on a silver platter courtesy of the government. Anyway, that's all for now. Thanks for listening.